Hi guys, it's Dr. Mo here from Inspire Medics. If you're just joining us, don't worry, you haven't missed anything. We're just about to get started. So this is the PLAB 1 and PLAB 2 webinar for menopause and ADHD. We are going to be covering the latest guidelines for menopause, and also we're going to be covering the latest guidelines for ADHD in terms of the key knowledge that you need to know. So Dr. Sandhu will be joining us soon as well, of course. If you don't mind, everybody, there is a chat box down in the bottom. Just quickly let us know where you're joining us from, so which part of the world. It does help us, obviously, know where you're joining us from today. And of course, if you have any questions, you can use the Q&A box down. There's a Q&A icon down at the bottom. You can press on this. Now this is going to be recorded, so we are going to upload this later on onto YouTube, and also we'll start streaming into our social media channels soon as well, once Dr. Sandhu has joined. So we'll get started soon. I can already see some of you are starting to let us know where you're from. So if you've just joined us, please just enter your location in terms of where you're joining us from. So for example, Oak is from the UK, Salome is from Uganda, Anna is from Leicester, and Ruhul is from Bangladesh. Just to remind everybody, today's topic is on the menopause and also ADHD. Menopause is also a female health topic. It's one that a lot of trainees as doctors, but also PLAB doctors struggle with as well. So it'll be a very good topic to cover today. Daban has joined us from Iraq, so welcome to Daban. We'll get started in about 2-3 minutes, just waiting for Dr. Sandhu to join us. And of course, there'll be probably a few other PLAB doctors joining us at the same time. So do stay tuned for a short while. I'm just going to start a screen share very, very soon. Welcome back, Megan. You're in South Africa, but you usually join from France, so not a problem. Shivangi is studying in Russia. Welcome, Shivangi. Okay, so we'll get started very, very soon. So what I'm just going to do is live stream this to Facebook as soon as Dr. Sandhu has joined us, and then we'll get started from there. So I'm going to do a screen share just so that we can start sharing the screen with everybody. Hopefully you should be able to see the screen that I am seeing. Okay, so if you can see my screen, give me a quick thumbs up. I'll give you an outline for today's topic as well. Fantastic, Saeed. Thank you for giving us a quick thumbs up. Let's see here. So I'm just going to stream this to the Facebook group as well. So just bear with me, guys, as I get this live stream to the Facebook group. So I can see Dr. Sandhu has just joined us. Just to let Dr. Sandhu know, we are trying to live stream to the Facebook group, which I'm doing now. There's been a couple of shout outs from a few people to let us know that where they're joining us from today. And I've already explained to everybody that it's the menopause and ADHD topic that we're going to be covering. And that's relevant for, of course, both PLAB 1 and PLAB 2. So if you want to keep an eye on the chat, VCAS, and I will get this live stream to Facebook.
Yeah, sounds good. Yeah, come on then, guys. So let us know whereabouts in the world you're from then. So let me just see what's going on so far. Let's get rid of all of this. Right. So yeah, so give us a quick chat whereabouts in the world you are at the moment, and then obviously we'll give you a shout out. This is a fun bit of the webinar, so we always like to see where exactly you're all coming from. I said 59 people have joined now, which is good. We'll get rid of all of this. Right, go on then. Okay, here we go. So Asma from the UK. Hi, Asma. We've got C2 from Myanmar. Fantastic. What time is it in Myanmar? That's on the other sside of the world. So keep it coming. Let us know where you're from, while Dr. Mo is going to stream it live to the PLAB 1 and PLAB 2 Facebook revision groups. We've got Shiley from Ashford in the UK. Brilliant. So Ashford, whereabouts is that actually? So I'm not sure where exactly that is, but so we've got Shyla from Ashford, got Raymond from India. Fantastic. Hi, Raymond. You've got Sally El Sheikh from Oman. Fantastic. So must be quite late where you guys are at the moment. It's about 6 minutes past 7 in the UK. Mohammed from Saudi Arabia. Aisha Arif from Pakistan. Situ, it's 12 midnight. Fantastic. Situ, thank you very much for joining us at the PLAB 1 webinar at 12:30 midnight. That's commitment. That's what you call commitment. You'll definitely pass your exams with that. So good. So Dr. Mo is now live streaming. So if you're joining us on the PLAB 1 Facebook group, or welcome. And if you do want to type anything, you can type it into the box on Facebook. The guys who are joining us live on Zoom, they can type in the chat box if they have any questions. We'll obviously be sharing our presentation so you can see it on Zoom, and you'll also be able to see it on Facebook as well. So if anyone's got any specific ones, good. Anyone else for any shout outs? Dr. Mo, let me know when you're ready, and then we will get started.
Okay, guys, we'll get started because there's a fair bit to get through today. These are one of the topics is relatively heavy, and of course the other one is to do with pediatrics, but ADHD of course can be diagnosed in adults as well. So you should be able to see my screen, and what I'll do is I'll make this a full screen for everybody.
Omera from Ireland. Hi, Omera, welcome.
Okay, guys, just give you a quick outline for the webinar itself today. So we're going to go through the menopause in terms of the new NICE guidelines and, of course, the existing NICE guidelines. We'll take an opportunity to take some answers and some questions and answers afterwards. Mahbub, good evening from Afghanistan. Fantastic. We'll then do some exclusive discounts for those who are attending this webinar. We've got 2 specific discounts today. One of the discounts is to do with the PLAB 1 Gold package. And also we have a discount code for the PLAB 2 Communications Skills course, which will be done remotely because of the COVID pandemic. Dr. Sandhu will then go on to do the ADHD topic, and we'll do some quite a brief question and answer session for that. And then finally, again, we'll release those exclusive discount codes in case you missed them at the beginning. So let's get started. Let's talk a bit about the menopause to begin with. Of course, this is women's health. This is a topic that is very, very likely to come up in PLAB 1, but also PLAB 2. And therefore, you need a reasonably strong knowledge base in relation to UK guidelines. So let's do a recap first. A lot of the times when we do these free webinars, I'd like you to walk away with 3 key learning points. That's 3 key learning points. As long as you go away with 3 key learning points for each topic, that's 6 key learning points you have altogether. And of course, that will put you in good stead for the exam, because that's 6 key learning points in 1 hour. You can multiply that by, for example, 100 hours of preparation. That's over 600 key learning points for an exam that obviously is going to test you on around about 180 different questions. So let's first start off with a recap. So menopause is obviously the cessation of menstruation, and it's defined as a time period of 12 months since the last period. So all this should be basically refreshing your knowledge since medical school. Now in the UK, the average age for the menopause is 51. Of course, you can have premature menopause where women enter early menopause in their 40s, for example, but the average age biologically when physiologically when a woman in the UK goes through the menopause is around about 51 or 51 exactly. Now, in terms of symptoms, of course, you need to know about symptoms of the menopause. If you get a PLAB 2 scenario where the woman's presenting with classical symptoms, or perhaps you have a PLAB 1 question to do with menopausal symptoms and management, you need to be able to distinguish the pathophysiology of the condition, which obviously tells you what the diagnosis is, which obviously will then allow you to make decisions on management. So in terms of symptoms, the classical symptoms are usually hot flushes and night sweats. You can get an effect on your mood. So women tend to get more irritable. They can start to feel a bit low in themselves. There can be musculoskeletal symptoms as well. So women can start to experience pains and aches as they start transitioning through and into the menopause. And of course, there are other symptoms as well. So these are sexual health symptoms and also urinary tract symptoms. So the sexual health symptoms women can experience are vaginal dryness. They can also experience a loss of libido. They can start to experience recurrent UTIs, and that can be as a result of the dryness around the vaginal area. And also they can start to experience disturbed sleep, whether it's because of the hot flushes, whether it's because of their mood. They generally tend not to sleep as well as they used to as they're going through the menopause. So these are some key classical symptoms you should be aware of. Keep them at the back of your head. Like I said, this is a recap, and really it should be refreshing your knowledge in terms of what you've already learnt. Now let's move on to the latest NICE guidelines and also the latest BNF guidelines. So I'm taking a lot of information from NICE, but also from the British National Formulary. So when a patient presents to clinic and they request, for example, HRT to control their hot flushes, which they may do, or you may offer HRT as a medication which would help with their symptoms, whether it's their mood, whether it's their MSK symptoms, whether it's their loss of libido, whereas it's their sleep disturbance. HRT usually is prescribed as one of the top choices, because obviously it's been shown to dramatically reduce the symptoms of, for example, hot flushes, and it's very, very effective, generally speaking. However, you do need to be aware of absolute contraindications for HRT. Now, I've broken them down into 3 categories for you. Those are cancer categories, they are cardiovascular or clot or embolism related categories, and they're also broken down into the liver category as well. So as long as you, in your mind, you have these 3 categories in your head, you'll be able to spot whether or not there's a contraindication for prescribing HRT in that female who's come to obviously get some management options for her condition. So in terms of absolute contraindications, if a woman has a history of breast cancer or an estrogen sensitive cancer, so you can get BRCA1 cancers, which are breast cancers which are estrogen sensitive, or you have a history of undiagnosed vaginal bleeding, which can indicate endometrial cancer, for example, or you have untreated endometrial hyperplasia, then in those instances, you would not be prescribing HRT. And then the second category you need to be aware of is the conditions which are related to the cardiovascular system or which can generate clots. Remember, there are 2 types of clots. You can get venous embolisms, so VTEs, DVTs, and pulmonary embolisms. But you can also get arterial embolysis as well. And this is obviously to do with conditions like MIs, CVAs, for example, and also in some cases angina. Untreated hypertension is, of course, another contraindication for HRT. And don't forget thromboembolic conditions. So things like, for example, antiphospholipid syndrome can increase your risk of developing blood clots, and therefore that will be a contraindication for HRT. Finally, the other very clear contraindication from NICE is acute liver disease, no matter what the cause is. So, for example, it could be hepatitis with associated abnormal LFTs. So NICE are very clear. You have to have abnormal LFTs in addition to the acute liver disease in order for it to be a contraindication. So if it's this acute liver disease itself and you have no abnormal LFTs, then for that reason, it wouldn't be a contraindication. So in your mind, whenever you're screening these patients in the PLAB 2 exam, or you've got a question in relation to HRT prescribing, think cancer, think the cardiovascular system and clots, and think the liver. And once you're able to do that quite quickly, you'll be able to spot the right answer based on the list of conditions which have been mentioned. So this is the first slide. This is the first key learning point. I hope you take away lots from this slide because of course, this is going to be very, very relevant. Let's move on to the next topic area, which is when you do go ahead, I mean, there's lots of different options for women in terms of managing their menopausal symptoms. For example, you can use SSRIs. You could use cognitive behavioral therapy strategies or options to address the effects on their moods. But if you are choosing HRT, you need to be able to choose which one's going to be the most relevant. So obviously HRT stands for hormonal replacement therapy. It often consists of a combination, which is usually estrogen and a progesterone-based HRT combined most instances, and they're available in 3 different forms, which are tablets, gels, and patches. Tablets are generally speaking the main form that we prescribe in the UK. Gels can be used, for example, if there's vaginal dryness, you may want to use a HRT gel around the vaginal area. And some women prefer patches. I remember patches avoid first pass metabolism, and so it's a different route of absorption which can bypass certain methods of metabolism, which can reduce certain side effects. So in terms of treatment, you want to break down the patients into two categories: if they're menopausal or if they're perimenopausal. So what does that mean? Obviously, if a woman has had a period over 12 months ago, her last period, and she's considered to have gone through, she's considered to be now menopausal, you would generally either prescribe an estrogen only or a combined HRT, and it could be a tablet, gel, or a patch. Remember, tablets are the most common. So if a woman does not have a uterus, it would be safer to prescribe a estrogen only HRT. However, with a woman with a uterus, you would always prescribe a combined HRT. And the reason is, if you prescribe an estrogen alone HRT in a woman with a uterus, it increases the risk of endometrial cancer. So that's very, very important to spot in a PLAB 1 question or a PLAB 2 scenario. No uterus, estrogen only. Has a uterus, so i.e. hasn't had a hysterectomy before, the combined HRT form would be recommended by national guidelines. Now, if you have a woman who's still not, become menopausal because her last period was 3 months ago, 4 months ago, 7 months ago, 9 months ago, i.e. it's less than 12 months, then what you want to do is, obviously these women fall under the classification of being perimenopausal, i.e. they're starting to transition into the menopause. They have menopausal symptoms, but their last period has been less than 12 months ago. So maybe they're having periods every 3 to 4 months, or maybe they're still having periods every month, but they're starting to experience menopausal symptoms. In a scenario like this, then you want to prescribe what we call a sequential combined HRT. What that means is, on certain days they're taking estrogen only, and then on other days they're taking estrogen and a progestogen HRT on the same day. And the reason for that is that they haven't quite entered the menopause yet, but they're starting to go through the change, and they're starting to experience the unwanted symptoms, which we've mentioned earlier, which are these. And obviously, a sequential combined HRT would still allow them to control their symptoms. So if a woman is perimenopausal, so she's last had a period under 12 months ago, but she's experiencing menopausal symptoms, but she's still having regular periods, let's say every 1 to 2 months, you would offer her a sequential combined monthly HRT. And that would allow her to continue to have periods on a monthly basis. And the way that's done is that that woman would take an estrogen only tablet every day, but for the last 14 days of her cycle, she would take an estrogen and a progestogen at the same time for those 2 weeks at the end. And then that allows her to have a normal period. In a woman who's perimenopausal, who is having a period every, let's say, 3 to 4 months, you would offer her a 3 monthly HRT. So this is essentially almost a 90-day supply. She takes estrogen every day. So every tablet will have estrogen in it, apart from the last 14 days, which would have an estrogen and a progestogen combination within the tablet. And because there's this combination in the last 14 days, it allows her to have a period at the end of her 3 months during that course of a sequential combined. So obviously you can choose which one will be most relevant depending on how frequent the woman's periods are if she's perimenopausal. Now, for women who are perimenopausal, once they've been on a sequential combined HRT for 12 months, you would then move them over to a normal HRT, a menopausal HRT preparation. That's very clear in the NICE guidelines. Or if the woman's over the age of 54, even though she may be experiencing perimenopausal symptoms, i.e. her period's less than 12 months ago, and she's still having hot flushes, she's starting to have hot flushes, you would still put on a menopausal HRT. You wouldn't give her a sequential combined. Yeah, so that's the criteria. If they've been on sequential combined for over 12 months, move them over to normal HRT, or if she's over the age of 54, you move them over to normal HRT. Those women should not be getting sequential combined. So again, this is quite a complex topic. You do have a read on NICE CKS, but this is the kind of the outline, the key piece of information that you need to know for the exam. Finally, there are some risks that you need to know about in relation to HRT. So if you're prescribing HRT, or you have a PLAB 1 scenario where you are going to prescribe HRT and the woman wants to know about the risks, you should of course counsel on the risks, but be aware of what the risks are. So in all HRT preparations, there is a small increased risk of breast cancer. There's a small increased risk of venous thromboembolisms, but the oral route has a higher risk than the transdermal route. And we think this is to do with, the studies think this is to do with the route of absorption. In terms of cardiovascular disease, if you prescribe an estrogen-only HRT, there's no risk, there's no or reduced risk for cardiovascular disease going forwards. However, if you prescribe a combined HRT, so that's an estrogen and a progesterone combined HRT, over the age of 60, there's a small amount of risk, so little risk involved of the risk of cardiovascular disease increasing, but there's no risk if the woman's under the age of 60. So bear that in mind as an age cutoff. Over the age of 60 on a combined HRT, small increased risk of cardiovascular disease. So we're talking about, for example, heart attacks and strokes. If they're under the age of 60, there's no increase. And finally, don't forget that there's a small generalized increase in risk with using HRT. There's a small increased risk in terms of stroke risk with HRT preparation use, whether it's estrogen only or combined. And then finally, don't forget with HRT usage, there's also slightly increased risk of ovarian cancer. So I think that's going to probably be the last slide for HRT. It's a quick run through in terms of the key learning points. What we did is we recapped the definition of menopause. We recapped the classical symptoms of the menopause, what the contraindications are for HRT if you're going to prescribe it for menopausal symptoms, which HRT preparation you should be using, depending on obviously where the woman is in relation to her menopausal or perimenopausal symptoms. And then finally, we covered HRT risks. What risks are there when you prescribe HRT to a patient? So as long as you've taken 1 or 2 learning points from each slide, you're doing very well. And that's the key thing with this webinar. It's only an hour. We just want you to learn 3 to 6 points that you're going to be able to take away for the exam. That's going to be fixed in your head, that you're able to obviously apply to clinical practice in future as well. So I'm just going to pause it there. We are going to give it a couple of minutes to take any questions. And then what we'll do whilst the questions are obviously are coming through is this, we'll go through the promotions on offer that we have. So hands up, quick show of hands. How many people are planning to sit PLAB 2 in the next 3 to 4 months? Just raise your hand if you are planning to sit PLAB 2 in the next 3 to 4 months. So we've got 7 hands have gone up, 8 hands, 9 hands, 10 hands, 11 hands. Okay, so about 12 hands. Okay, quick. So I'm just going to 14 hands. Fantastic. Okay, if I can get everybody to lower their hands, I'll do it from my side. Can I get a quick show of hands? How many people are going to be sitting the PLAB 1 exam in the next 3 to 4 months? Quick show of hands, PLAB 1 in the next 3 to 4 months. We've got 10, 11, 12. Okay, so we've got about 12 people, 14 people sitting the PLAB 1 exam. Okay, guys, so I've got something really interesting for you, which is it's going to do a quick screen share. So Dr. Sandhu can chip in at any moment if he likes. Hopefully you can see my screen. We've got a PLAB 2 communication skills course. It's a full day course. It runs on a weekend, 10 o'clock UK GMT time to 5 p.m. UK GMT time. Me and Dr. Sandhu will go through advanced communication skills for the PLAB 2 exam. And what we'll do is we'll apply those PLAB 2 communication skills for all scenarios that you are most likely to come across: ethical cases, data gathering, result station, SIMMAN. And we'll also talk you through how you apply those communication skills to data gathering, but also management. It's a full day course. You'll get a lunch break in between, but it will significantly boost your marks in terms of your interpersonal skills. Now, the course is usually priced at £150. We've got 2 dates. We've got the 15th of November and we've got the 10th of January. So in the next 3 to 4 months. And what we're going to do for the first 5 people who subscribe to this PLAB 2 communication skills course, will offer them £50. So the way it works is the first 5 people who subscribe will get a £50 discount that they can use, but then the system will lock out and the price will remain £150. So for example, let me show you. If I go for the 15th of November as a date, and I add to cart, the discount code for the PLAB 2 communication skills course is 502020. So so here you can see in my cart is the PLAB 2 communication skills course. What's going on here? Why is there not a price? Oh, let me go back. Let's try that again. It's going to add the 15th of November to the cart. Okay, we seem to have a slight glitch there for some reason. I'll have to double check that in just a second. Okay, let's try again once more. Hopefully it'll work this time. Let's try the second date. Let's try the 10th of January. I'm just going to add it to the cart. Hopefully it'll work this time. Okay, guys, we've got a slight glitch here. What happens is there should be a price here for $149.99. I was going to show you how to apply the discount code itself. Let me try a brand new window. Okay, let's try it once more. Hopefully it'll work this time around. If not, I'll hand over to Dr. Sandu whilst I try to fix it quickly in the background. But anyway, so I'm going to show you the PLAB 2 communication skills course page. So once you've added to cart, it should basically. Okay, it's not working. So VCAS, I'm just going to hand over to you for a second, if that's okay. If you turn on your mic and.
Yeah, no worries. So I will. You have got a few questions, but what we'll do is let's get my one sorted, and then we will troubleshoot some of these questions as well. So, so Dr. Mo's going to have a look into that. In the meantime, we're going to load up the second. Can you just make me a host on the thing so I can share the screen? No, make me a host on the thing. Okay, perfect, done. Right, so let's get stuck into it. So part 2 of your talk is on a hot topic. So this is important for PLAB 1 in terms of the clinical knowledge, but relevant for PLAB 2 doctors as well, because ADHD is something which, although it affects children, can affect commonly teenagers, and of course it can affect adults as well. So you can easily get a case on this.
Yes, I've just got it to work. If you don't mind, I was going to do a quick screen share, if that's okay. Sorry, guys, I just managed to get it working again. There's a slight technical issue.
Yeah,
I'm just going to share the screen once more. Okay, guys. So if you apply, if you choose the date that you want to select, and then down at the bottom, what you'll get here is apply coupon code. Now the coupon code will only work for the first 5 people, and the coupon code is 502020. So obviously it'll count down once you've paid. I'm just going to apply it to show you. So it's $149.99. Once the PLAB 2 Online Academy discount code is applied, it's $99.99. So we highly recommend that. And then the second thing I want to show you is our PLAB 1 Gold package. What we can do for the PLAB 1 Gold package, because I know some of you are preparing for the PLAB 1 exam. So we have different packages. We've got the bronze, silver, and gold. We can do the bronze for $4.99. We can do the silver one for $24.99, and we can do the gold package for $74.99. So the gold package, you get 3,500 questions rather than 2,500. You get 750 revision podcasts for the PLAB 1 exam, and you get 750 teaching videos, and you get free flashcards sent out. So for this, it's again only the first 5 people will get 50% off, and the discount code is 50 gold, 50 GOLD in capital letters. Again, add to cart, scroll down to the bottom, and then check out. So I'm just going to do a stop screen share. I'm just going to answer some questions here. So Dr. Visal, I said, when a perimenopausal woman takes estrogen only, wouldn't there be a risk of endometrial cancer? So a perimenopausal woman, let me just double check here. No, Dr. Vissal, the reason that's not the case is because you're using a sequential combined HRT preparation, which means they get some progesterone at some point in the cycle. So it isn't going to be estrogen only for the whole month. It's only estrogen only for half the month if it's a monthly cyclical combined. Sequential combined, or if it's the 3 monthly, she's still getting progesterone at the end of her cycle. So that's the key thing to understand there. Hope that answers the question. If not, let us know. Salome, which doses of estrogen and progesterone to give? Salome, just refer to the BNF, the British National Formulary. You'll be able to choose different HRT preparations there. There's fixed estrogen and progesterone only preparations. You get a low dose and a higher dose. Often you start off on a low dose and then you can build up the dose from there. But again, the BNF is the right place to refer to that. Okay, Yara, thank you for your comments. Thank you so much. Why estrogen alone will cause endometrial cancer? Okay, Aisha, if you give an estrogen alone preparation to a woman who has a uterus, it increases the risk of endometrial cancer because unopposed estrogen without progesterone in the studies has shown to increase the risk of endometrial cancer. It's a known risk factor, unopposed estrogen in a woman with a uterus. And that's the reason why you shouldn't give estrogen alone HRT preparations in a woman with a uterus. Hope that answers the question. Okay, guys, I'm going to hand over to Dr. Sandhu in this case, and he'll talk a bit about ADHD.
Perfect. Thank you very much, Dr. Mo. So welcome, guys, to the second part of your talk. So we're going to talk about the condition ADHD, or attention deficit hyperactivity disorder. It's important for PLAB 1 in terms of the clinical knowledge, because you can easily get questions on this in terms of how to diagnose and how to manage, and relevant to PLAB 2 because it's a condition that's often picked up in older children. It's an easy one for them to have access in for with a parent and a child, a teenager who can act. So important that you have a bit of an idea and you know about the key bits so you can take away some good learning points from the current UK NICE guidance. So what we're going to talk about, we'll define what ADHD is. We'll talk a bit about what the key features are, how we diagnose it, and of course, how we manage it. So applicable both to PLAB 1 and especially to those preparing for PLAB 2. So what is ADHD? Well, specifically NICE uses some specific buzzwords. It's a behavioral syndrome, and you get these three things. You get hyperactivity, impulsivity, and inattention. And we'll talk about all of these three in a bit more detail in the coming 3 slides. But basically, these are the key things. So the child or the adult is hyperactive, they're very impulsive, and they lack the ability to focus, so they've got inattention. What causes ADHD? So the exact cause is not known. There is some evidence to suggest that it could be a genetic condition. So if the parents had it, they may pass on their genes to their kids. But there is a current evidence to suggest that there's environmental factors, so things that people are exposed to, which can increase the risk of ADHD. Some of these can start during pregnancy. So for example, a low birth weight, a mother who smokes during pregnancy puts a child at risk of ADHD. Babies born preterm, so the earlier they are born, the more likely they are to be exposed or possibly go on to develop ADHD. Then you've got neurological things to think about, like epilepsy and acquired brain injury. You've got your metabolic causes, so excess exposure to lead is a key risk factor, iron deficiency, excess alcohol exposure during pregnancy, and then people who've got psychological issues, so people coming from adverse maternal mental health and psychosocial problems may be more at risk of developing ADHD. In terms of the diagnosis of the condition, basically NICE has got a specific criteria. So what NICE says is that you need to have at least six of the following: 5 in adults of inattention, and at least 6 or 5 in adults of hyperactivity or impulsivity symptoms. So these symptoms have to have started before the age of 12, and they have to be present in 2 or more settings. So that's the key thing to remember, that it's not just a child who misbehaves at school, but likely what they're doing at school, they're doing at home as well. So when you're taking your history, you have to ask, I know you've mentioned that this is happening at school, Mum, but what is your child like at home? And actually they'll tell you that the kid has the same behaviors at home as well. has to be present for at least 6 months. So it can't just be a one-off acute event or an infection or something like that. And it has to interfere or reduce the quality of life and social, academic, or occupational functioning of that patient. So in other words, it's a significant thing that's affecting them in their day-to-day life. And obviously there shouldn't be an obvious other cause for their symptoms. So you need to have at least, what are the symptoms that you need to have? Well, the symptoms of inattention. So I've made this nice little graph for you. And basically what you can see is that the key features of inattention are basically when you get, for example, a child who fails to give attention to the details and makes careless mistakes in schoolwork. Now, remember the key thing in the slide before is that this has to be there for 6 months. So you could argue that everybody does number one. You know, there's always times when you may not be focusing, but the key thing is in ADHD, the child will be, or the adult will be doing this all the time consistently over a period of 6 or so months. Difficulty in maintaining concentration when they're doing a task or they're playing, appearing not to listen. So somebody is talking to them and they just seem like they're daydreaming. And again, everybody does this, but someone with ADHD will do this all the time consistently for more than 6 months. Failing to follow through instructions. So, you know, they've been told to do something and they just don't do it. And that's a key feature of ADHD. Difficulty in organizing tasks and activities, reluctance or avoiding tasks that require them to have a bit more mental effort. Losing things as well. So losing lots of things that they need, like pencils or mobile phones or wallets. Easily distracted by other people and stimuli in the room, and being forgetful as well with regards to sort of day-to-day activities. So these are the key features of inattention, of which a child should have 6 and adults need to have just 5 that have to be there for more than 6 months. Then you've got the hyperactivity or impulsivity symptoms. So someone who's hyperactive or impulsive is often fidgeting and tapping with their hands or feet, leaving the seat when you should really be sat down. For example, if everybody else sat down in the classroom, but this kid will just get up and start walking around, running about or climbing in situations where it's inappropriate, inability to engage and play in a quiet manner, being on the go or acting like they're driven by a motor. So somebody's just constantly on the go, talking a lot, so talking too much, blurting out answers before the question has been completed, difficulty waiting for his or her turn, and interrupting or intruding on others. Now, remember, everybody to a certain extent does these things, but someone with ADHD will do it consistently day in, day out in 2 or more settings for more than 6 months. And remember, you just need to have 5 of these if you're a child or 6 of these if you're an adult to get the diagnosis. How do we manage it? So obviously the first thing is they need to be seen by a specialist. So we refer them in the UK to a specialist pediatrician. If it's a child, then we have something, you may have heard of this if you're working in the UK. If you're not, you may not be aware of CAMS. CAMS is basically the Child Adolescent Mental Health Service. And of course, if it's an older kid, an older adult rather, you can refer them to the adult psychiatrists. CAMS is interesting. If you're doing PLAB 2, if you mentioned CAMS, you'd probably raise the eyebrow of your examiner because they would be like, this guy or this girl knows their stuff. They're an international doctor and they've mentioned something about UK medicine, which I didn't think they would know. So, you know, if you've got a child, a teenager up to the age of about 17 who has mental health issues, you can refer them to CAMS. CAMS stands for the Child and Adolescent Mental Health Service. So it's a good little trick to have up your sleeve. Obviously, if you work in the UK, then you'll probably be familiar with this if you're a GP or if you've worked in A&E. What kind of stuff happens? Well, they do simple things first, so psychological therapies. So there's education to both the patient and the parents about what ADHD is and how they can do things differently to allow their child to function properly. There's group psychological therapy, such as cognitive behavioral therapy and social skills training. So cognitive behavioral therapy, remember, is a type of psychological therapy where it's a bit like counseling, but the difference is the therapist then challenges the adult or challenges the child about why they're having those thoughts, and then they look at ways that they can try and overcome those thoughts together. You can get drug treatment. The classic one, so you've got a few drugs that are often given, so things like methylphenidate, which has a trade name called Ritalin. There's atomoxetine, dexphetamine, and similar brands drug of that one. But the commonest one that we use in the UK is something called methylphenidate. It's got a trade name called Ritalin. And it's interesting because what it does is it actually increases central nervous system stimulant. So you think, well, why are you giving a central nervous stimulant to someone who's already hyperactive? And it's really bizarre, but what it does is it increases the levels of dopamine in the brain. And that's thought to keep the child or the adult more focused. So they become less impulsive, less hyperactive, and show less features of inattention. So it's an interesting way that it works. They're normally on it long term, but obviously once the child or the adult starts to improve, there can be the option of trying to reduce it, but normally it's given anyway in conjunction, so combine it with psychological treatment. What else do we need to be mindful of? So if you're preparing for PLAB 1, you can get a question easily about, a STEM where a 13-year-old boy is diagnosed with ADHD, he's put on methylphenidate, which of the following needs to be monitored? If you're doing PLAB 2, you could be coming to a shared management plan with your patient, in which case you may have started them on this drug, and then you've got to get the golden nugget mark. So you've got to be able to know that these are the things that need to be monitored. So if patients get started on drug treatment like methylphenidate, usually it's started by the pediatrician and then it's taken over by the GP. And what you have to do is there needs to be one monitoring of the weight, which is every 3 months in children who are 10 years and old and younger, and 3 months, every 3 and 6 months after treatment has started. You monitor their weight every 6 months in adults. The height, you need to check it every 6 months in children and young people. And the blood pressure and heart rate before and after each dose change, and every 6 months. And obviously you need to compare the results that you have with the normal range for that person's age. So monitor the weight, monitor the height, and keep an eye on the blood pressure and the heart rate. They're the key things that we need to monitor because we can sometimes get some side effects from, especially from methylphenidate. Then you sometimes get a question. So patients may ask you, well, is there any specific dietary things that I need to avoid? You may get a PLAB 1 question, what type of dietary things should we avoid? What does NICE tell us? Well, the current UK guidance says that really, as long as the child or adult has a balanced diet and takes regular exercise, they should be fine. You don't have to. So patients often ask about this one here. They ask about, do I need to get rid of artificial colorings and additives that are put in lots of food, especially the processed foods that people eat? But actually, you don't have to remove this from your diet unless you can prove, in other words, the parent or the child can prove that there seems to be a link. In other words, they eat certain foods and their behavior changes drastically, in which case you can then eliminate that food or drink and see if the behavior changes. But otherwise, you don't have to do that. Good, so that leads us on to the questions. Obviously, quick one for our social media. I'm sure many of you are probably already following us, but if you're not, make sure you have a look at our Instagram page, inspire_medics. We'll put the links in shortly. Facebook page for PLAB 1, which is currently live. So this is being live streamed to the Inspire Medics PLAB 1 Facebook revision group. There is also a PLAB 2 Facebook revision group where you can kind of see some of the other things that we're doing. We've also got our YouTube channel, Inspire_medics, and our Twitter page as well, Inspire_medics, and LinkedIn if you're on there. These platforms are very good because we post learning material on there, which is very relevant to PLAB 1, PLAB 2, as well as other UK-based exams like GP exams and other exams that you do as junior doctors. So do have a look at the learning cards and the short revision videos. And I will stop the screen share there to see if there's any questions. Is there any questions that have come up?
Guys, I'm just going to give you a quick update while obviously you think about questions. We've only got 2 discount codes left for the PLAB 2 communication skills course. They're going very, very quickly. I think people are checking out and using them. We've only got 2.
I've got an idea. So I think if the next 2 take it for 50, we should make the next 5 25. So we should give another, if there is 10 of them, because I think there's 14. So maybe if the next 2 get £50 off, and then the other 5 after that, if they're still interested, you can get £25 off the PLAB 2 communication course. It was a 10-day course. We have got Charles here, who's our superstar from the first academy. But actually what we decided was because we've had another batch, but they sometimes couldn't turn up on some days. So we've decided to make a brand new one-day course, be short, snappy, high yield cases, live demonstrations, and a chance for you guys to practice as well. And we thought, let's make it a day, make it more easily accessible to everybody. So rather than what we're currently doing, which is a 10-day kind of half a day sessions. So do take it if you want the £50 off today, go for that. Sorry, over to you, Dr. Mo.
Yeah, and then we've only got 2 discount codes left for the PLAB 1 package as well. That's 50% off. That's 5050 gold in capital letters. The PLAB 2 communication skills course discount code is 502020. So again, those are going very quickly. I think probably in the next 5 minutes, they probably would have gone, because I can see some people checking out in the system and the back end. I think there's a question that's popped up for you, VCAS. I'm just going to do a quick screen share for everybody just to show everyone had to apply the discount code. So if you choose, let's say, the 10th of January, add to cart, and then it's a simple case of scrolling down to the bottom of the page, and then you'll find at the bottom of the page, use coupon code. And in this case, if it's 502020, hopefully the system wouldn't have locked me out this yet. You apply the discount code, and then from there, once it's applied the discount code, you'll see the new price of $99.99. You can then proceed to checkout, and then you can log in. So if you log in normally with your social media logins, that's fine. You may have to enter your address for the card, or if you're already logged in, of course, then you could use your account that you're already logged in with. So that's just a quick show of how you can use the discount code. So yeah, Vikas, if you want to, you've got a question there which you may want to have a look at.
So a question from Anna: is the therapy the same / similar for both children and adults diagnosed with ADHD? Yes, Anna, that is correct. So the therapy that you do is very similar for adults and children. There's no significant difference at all, apart from the fact that the child, it's just a cut-off age. So in the UK, I think once you hit 18, you go under the guidance of an adult psychiatrist. Under the age of 18, you're under the CAMS, so the Child and Adolescent Mental Health Services. Good, so I hope that helps clarify. Good. So keep the questions coming in, guys. I will post our Instagram links and stuff as well. Okay, so Dr. Mo's just saying that there's 1 discount code left now. So the last £50 off for that communication skills course, if anybody wants it. Snap it up, it's pretty good. So you've probably seen us on the 100 station video course, me and Dr. Mo, which is pretty good. It's only £20. That's on the website as well. So you'll have probably seen us on there, but the communications course is a bit more detailed. It's broken down. We will adapt it as well because the PLAB 2 has changed because of COVID. So the telephone consultations, and there'll be a strong focus on that and how to deal with them. Different cases, high yield cases based on examiner feedback and feedback from our current trainees have gone through as well. So do snap that up. Good. While he's doing that, I'm just going to post our Instagram links and stuff as well. So if you're not part of our social media channels, make sure you join them, because there is lots of good material on there for you guys that you'll find useful. That's the Instagram. This is the YouTube channel. And I'm just going to give you the PLAB 1 Facebook group as well for those of you preparing for PLAB 1. Those of you,
quick update, there's one discount code left now for the PLAB 1 gold package if you want to use it. There's still 1 remaining for the PLAB 2 communication skills course. In 2 weeks time, we're going to have some new topics. We're going to do BPPV, benign positional vertigo, and also we're going to do depression as a topic. So again, these are 2 hot topics which you'll see a lot in the PLAB exam, and those are coming up very soon in 2 weeks time. So we'll send out an invite to those hopefully in the next 48 hours. So yeah, sorry, Dr. Sandy, over to you.
Yeah, so that's it really, guys. So I mean, obviously it's a quick overview. There is another thing we have, which is a visa service. So when you're planning on coming to the UK, because of the demand and some of the things that some of our students have asked us, we've teamed up with a legal team. So we will be running a webinar. I think if Dr. May, if you can dig out the Zoom link for that. So that webinar will probably be in a couple of weeks. I think it's October the 25th on the top of my head, but we'll give you a quick overview of what's going on at the moment in the UK. There has been some changes in recent weeks. So we've spoken to the legal team and we'll talk you through the PLAB visa process. There's also a kind of a package that we have where they can actually just take you through the whole process and do it for you and tell you what you need to do. So keep an eye. I think Dr. Mo's just posted that link, so do sign up to that. That's a visa webinar, more relevant to those guys who are on PLAB 2, who are coming close to sitting the PLAB 2 exam, and are, you know, heading close to coming to the UK. Like I said, there has been some recent changes, so we'll update you on that, and there'll be an opportunity to ask questions. We'll also probably get our lawyers in at some point as well to actually do a webinar for you guys. So, you know, do get ready for that. Mohammed's got a question. So, ADHD in children, when they grow up, they become something related to personality disorder. Yep. So ADHD, like many other mental health problems, can be a trigger for other problems, and personality disorder is an obvious one. So, you know, that's definitely something to be mindful of. And it's just like many other psychiatry things, really. So it can always be a risk factor for other problems later on, which is why it's important that it's picked up early. It's normally picked up by schools, so it's normally the schools that will tell you that this is what's going on, and then the parents will be like, well, actually, he does that at home as well. And then you start to piece it together, and then you realize that it's a continuous, it's not a one-off, it's not, you know, every so often this child does this. They start to do it all the time, hyperactive, jumping around, not following orders, you know, constantly not focused on anything. And that's where the medication and the psychological therapy comes in. Good. So I think we're about to wrap up then. So Dr. Mo's just posted a few links. So you've got the social media links, so do keep an eye on that. So Twitter's very good if you're planning on coming to the UK, because we'll have all the latest UK news on there. So do follow us on that. The discount codes are going through. So last discount code for PLAB 1 and PLAB 2, 50 2020. If you're going for PLAB 1, just put in 50 gold and you'll get the PLAB 1. So remember, we've got a free question bank, which has got 2,500 questions. If you go for the gold package, you basically get another 1,000 questions, and you get 750 video questions where you get a mini lecture after each question. You get 750 podcasts, which is the UK guidance that you can listen on a headphone. And that has just reminded me, I'd like to show you something, guys. So if it's okay with Dr. Mo, so I'm just going to do a quick screen share about an educational resource on our website, which I think you're going to find very, very helpful. So I'm going to start a quick screen share, so just so you know where it is on the website, and then you can use it for your revision. If you're preparing for PLAB 1 or PLAB 2, you just need to click this. So if you can see this, guys, this is the iMedix website. Obviously, you're all familiar with this. If you scroll across here, you get to the blogs. This is a brand new section that we've just been uploading in recent weeks, and there's a lot more to come on this. So if you see here, you've got click blogs, you've got doctor blog, patient information, iMedix blogs, and the latest medical news. And I want to click doctor's blog. So we click the doctor's one, and that takes me to this here. Now you've got, it says here PLAB, click that. You've got articles for PLAB 1, you've got articles for PLAB 2, UKMLA as well, because obviously things are changing, and we're proud to announce that actually we've released the first ever UKMLA question bank. So if there's anybody here who's going to be joining, planning to move to the UK in 2023 onwards, this bit, your UKMLA, the question bank will be relevant to you. If you're coming before that, don't go to the UKMLA, stick with the PLAB 1 question bank, but we have relaunched the first ever UKMLA bank. So why is this bit relevant? Well, look, you've got so many articles that are like female catheterization. If you're doing the OSCE for PLAB 2 and you're prepping and you're scared, our team have made it nice and easy for you. Look, introduce, greet the patient, wash your hands, put your gloves on, put your PP on. So all of that kind of stuff. What equipment do I need? How do I prep? What do I clean? Nice and simple, easy to follow. It's good for your revision. There's lots of things like this, hundreds of articles that are going to be uploaded. And they're coming because we want to make the revision more fun. You can see, look, subcut injection, intramuscular injection. There's lots of different pages, so use that blog section. Dr. Mo's put the link in, thyroid exam. And when you click these videos, for example, shoulder exam, let's have a look at the shoulder for the OSCE. You'll get the same kind of stuff in a nice and easy to digest manner so that your revision becomes more fun and it becomes easier for you to retain the information. We also have lots of things really, so you can keep on going. The list is endless, so use that resource. It's there for you guys for your revision. There will also be patient information leaflets coming, of which some are already ready. So for example, let's take this one, Crohn's disease, everything you need to know in 60 seconds. This is very good for you guys who want to learn about how to explain a condition. So you're in PLAB 2 and you're in a pickle, you're going to diagnose Crohn's disease. You're going to say, Mrs. Smith, having listened to your story and having examined you and looked at your blood results and your endoscopy results, it looks like you've got a condition called Crohn's disease. Do you know what this is? No, doctor, I've never heard of this before. Crohn's disease is a condition that causes inflammation of the lining of the wall. It goes from anywhere from the mouth all the way down to the anus. Simple, nice and simple. This is the level that you need, not just for PLAB 2, but for your professional exams in the UK as well. So this is your resource. I want you guys to use this. It's free. Share it with your friends. Use it regularly. The patient information leaflet will be relevant for you, and it will be relevant for your patients. So if you're in wherever you are, India, Pakistan, Bangladesh, the Middle East, Europe, and you've got somebody with contact dermatitis, you can signpost them and say, by the way, here it is. This is what dermatitis is. These are the symptoms. This is how you diagnose it. This is how you treat it. Nice and simple. So thought I'd share that with you guys. So do have a look. If there's any articles that you want, if there's any videos that you want, remember our Inspire Medics is you guys. You are the guys that make Inspire Medics what it is. So if there's anything you need, let us know. Those of you who sign up to our courses, you get a personal service, which is that even after the exam, if you're stressed, if you're worried, if someone tells you about something and it throws you off, get in touch with us on WhatsApp. We've got a dedicated team. They will triage your information. And sometimes doctors just want to talk to us because they're anxious. So we say, look, give us a call. And Dr. Sandhu or Dr. Moe will have a quick chat with you. And we do that to everyone who signs up to our courses, the communications courses and stuff. So that service is there. So use it. We're trying to help you guys to get to the UK and be successful doctors. And even if you don't come to the UK and you stay wherever you are, the key is that you become good doctors with strong communication skills and good knowledge. And we want iMedics to be part of that journey. So that's it from me. I think I'll wrap it up there. I think I'm getting carried away. And I'll hand it back to Dr.
Yeah, absolutely, guys. I think there's one more discount code left for each of the communication skills course and the PLAB one. Do use it if you're interested. You'll get £50 off or 50% off. We'll see you in 2 weeks' time. We've got 2 further hot topics. Please keep an eye on our blog section. You're going to find it really, really useful. And very soon we'll have a game feature, which obviously did go live about a week ago onto the PLAB one question bank, but it's going to go live again, hopefully in the next few days. So I hope you enjoyed today's revision session. Do let your friends and colleagues know, and we will see you in 2 weeks' time. So take care.